Let's talk about ADHD today. We will briefly touch on the 8 facts I need you to know to crush ADHD. First off, let's do some numbers. According to a national 2016 parent-filled survey, approximately 6.1 million or 9.4% of children are diagnosed with ADHD. Among adults, the number is 4% of adults ages 18 to 44. Boys are more likely to be diagnosed with ADHD than girls, 12.9% compared to 5.6%. For children 2 to 17 years of age with ADHD, 62% were taking ADHD medication, while 47% are receiving behavioral treatment. Altogether, 77% were receiving treatment. About 23% of children with ADHD are receiving neither medication treatment nor behavioral treatment. Up to 30% of children and 25 to 40% of adults with ADHD have a coexisting anxiety disorder. Sleep disorders affect people with ADHD 2 to 3 times as often as those without it. Similarly, ADHD increases the likelihood of having a depressive disorder by at least 2-fold. Now, fact 1. What is ADHD? Attention Deficit Hyperactivity Disorder refers to one of the most common cognitive conditions that children are diagnosed with. Adults suffer from it too. ADHD is a neurodevelopmental disorder that develops in the early years of a child's life and is highlighted by hyperactivity, poor impulse control, and an inability to remain focused. 2. What causes ADHD? ADHD is not caused by children consuming sugary foods and beverages, watching too much TV, or playing too many video games. In fact, there is a video game that is FDA approved now for ADHD treatment. More on that later. Also, ADHD is not caused by food additives, allergies, or immunizations, nor excess screen time. Research to date has shown ADHD to be an interplay of nature and nurture. As for nature, a low level of activity in the parts of the brain that control attention and activity level is implicated. Genes and heredity are also important. A child with ADHD has a 1 in 4 chance of having a parent with ADHD. Some genes that are being studied are DRD4, DRD5, DAT1, SNAP25, and COMT. Remember, it is a complex disorder, not an indication of motivation. ADHD is not the same as IQ or depression. However, ADHD and other disorders often have comorbidities. Environmental factors are also important. The 2 big ones are alcohol consumption and smoking during pregnancy. Maternal obesity, protracted or complicated delivery, prematurity and low birth weight, intrauterine growth restriction, infections, and exposure to lead and other toxins, like pesticides, PCB, and polychlorinated biphenyl have also been implicated in the ADHD diagnosis. Finally, adverse social and family environments such as low parental education, social class, poverty, bullying, domestic violence, and family discord can also lead to ADHD-like symptoms. Number 3. How is ADHD diagnosed? To diagnose ADHD, your child's doctor will first do a series of physical examinations and diagnostic tests to rule out other medical or psychological disorders. After the initial consultation, you and your child's teacher may be given an assessment form to fill out over the course of a few days while observing your child. The assessment form will help your doctor identify and quantify behaviors. The school input is essential to rule out any learning disorder. Number 4. Does diet help? There is a lot of controversy about the subject, but there is no proof that sugar causes ADHD. Research, however, shows that refined sugar and carbohydrates can affect your child's activity level by quickly entering the bloodstream. When blood sugar spikes, your child may become much more active. The burst of energy is from an adrenaline rush caused by the rise in blood sugar. Nutritionists recommend adding more fiber to your child's diet to help keep blood sugar levels even. High-fiber foods include berries, fruits, whole grains, and oatmeal. Thinking about dietary modifications in taming ADHD? Think breakfast. A great way to start your day is by eating proteins and complex carbohydrates. Number 5. Does therapy help ADHD? Yes, it does. So let's briefly touch on a few modalities. Behavioral therapy. Behavioral therapy is quite interesting. It employs the use of various activities and methods to help develop and strengthen emotional, social, and other basic skills. Behavioral therapy targets these disruptive and attention deficit behaviors, making it one of the most ideal forms of treatment. It also helps eliminate unwanted or less than ideal practices, such as impulsivity. Cognitive behavioral-based treatments. More useful in adults, these modalities may also improve common comorbid disorders that affect adults with ADHD, including irrational anger, fear, anxiety, depression, etc. EEG biofeedback therapy or neurofeedback is recommended as a potential treatment option based on its ability to reduce the levels of arousal in front brain areas of persons with ADHD. Social skills training. This training helps kids with ADHD navigate difficulties in social environments. The goal of social skills training is to teach new and more appropriate behaviors. Parenting skills training, meanwhile, is meant to help parents acquire tools and techniques for understanding and managing their children's behaviors. Number 6. What about supplements and ADHD? Fish oil works. It helps your brain function at a healthy level. Fish oil or omega also helps maintain a healthier weight. Magnesium has traditionally been used for nervousness, irritability, and insomnia. It is a powerful calming agent and helps with ADHD symptoms like distractibility as well as hyperactivity. Iron regulates neurotransmitters, and by regulating neurotransmitters, iron can help with focus, less impulsivity, and reduce anger. Zinc boosts dopamine and serotonin in your brain, which helps to reduce ADHD impulsivity. Vitamin C controls many brain functions related to concentration and focus and cognitive tasks. There is no proof that other supplements like ginkgo biloba, St. John's wort, or pycnogenol treat ADHD symptoms. 7. Pharmaceutical intervention. Medication therapy is often used in combination with behavioral therapy. Typically, your physician will choose from 3 main classes of medications, such as stimulants, for example, Adderall, Vyvanse, Focalin, or methylphenidate. Non-stimulants, like atomoxetine, velocitine, Capve, clonidine, or guanfacine. Or one of the antidepressants, like bupropion, dizipramine, nortriptyline, or imipramine. Furthermore, modafinil, a wakefulness-promoting drug, amantadine, an antiviral drug, and brain-specific S100 protein-based medications are also used off-label. Most common homeopathy herbs used are stramonium, senna, and hyoscyamus. Chinese herbs most commonly used are thorowax root, skullcap root, paria, and red jujube. In Ayurveda, or ancient Indian medicine, main herbs used are vacha, ashwagandha, brahmi, guduchi, and shankapushpi. And finally, number 8. What's new? A new amphetamine. The U.S. Food and Drug Administration, or FDA, has recently approved Tris Pharma's Dianavel XR, or amphetamine, for the treatment of ADHD, an extended-release tablet to be taken only once daily. FDA also approved Quellbri, which is a new non-stimulant medication for children ages 6 to 17. CBD has been gaining a lot of traction as a medically beneficial botanical. Though there is sufficient evidence that CBD is beneficial in reducing pediatric anxiety, many of the CBD options that may aid with ADHD contain THC, which is not ideal for children. The external trigeminal nerve stimulation, or ETNS systems, is the first ever device approved by the U.S. Food and Drug Administration, or FDA, as a form of treatment for pediatric attention deficit hyperactivity disorder. Lastly, meet Endeavor RX, which is the first FDA-authorized video game for ADHD, and it is geared towards improving the attentiveness of children 8 to 12 years old with ADHD. Please remember, treating ADHD is best when done early. As soon as you suspect your child may have the disorder, act and get professional help. To find the best treatment options, work closely with the healthcare practitioners and the other persons who interact with your child daily. Collaboration is one of the best methods for optimal patient outcomes. Till next time!